Hi, my name is Stephanie Keith, and I am a licensed professional counselor in the state of Pennsylvania. I have been in the mental health field for a little over 10 years now. I'm a nationally certified counselor as well as an ally of the LGBT community. I have several specializations and experience with treating various clinical issues, which should be listed on my profile. However, if you don't see it there, please don't hesitate to just ask me. As far as my approach to sessions go, I typically utilize a combination of CBT, client-centered, and motivational interviewing. However, I really am a firm believer in utilizing treatment modalities that best suit the client, their presenting concerns, and their needs. It really is essential for both the client and counselor to feel that it's a good match, as this will ensure that therapy is the most effective, which kind of brings me to what a first session with me will look like. So typically the sessions run about 45-55 minutes, and I usually ask a list of questions to give us a chance to talk more about your background, your history, and we discuss your presenting concerns, of course, and any symptoms, and then we kind of conclude with identifying some goals you may like to achieve. So I start with these questions to kind of give the client an opportunity to feel comfortable, to kind of build some rapport, as this is essentially the foundation to the client-counselor working relationship. There is a common myth that people assume that therapy, is an easy fix or maybe an advice gathering session. However, I really try to encourage my clients to be open to exploring their situation and then kind of independently work on making improvements in between sessions based on what we've discussed. So then we can kind of determine, is this working? Is this not working? And what doesn't work is perfectly okay. Not everything's going to work. And then we can kind of make different changes to improve your quality of life as it does pertain to your presenting concerns. As far as my availability goes, I'll always have some weekend hours and some evening hours. However, each week, the actual times and days may vary, but I know how important it is to have these hours. So I'm going to do my very best to kind of ensure you have a time slot that works for you. I know that home and work-life balance is really important, so I do want to kind of work with you and we find what works best. Before I conclude, I did want to share how my personality influences my approach to therapy, as I believe everyone should feel validated. I think when they express their feelings, they should feel validated because feelings are always valid and no one can tell you they're not. I want everyone who is in counseling with me to feel safe and comfortable. And then I really just kind of hope this has helped you kind of form a better idea of who I am as a person and therapist. And I really do want to commend you for seeking support right now, as this is not an easy step by any means, and it often goes overlooked, but it's not easy. If you have any additional questions, please don't hesitate to ask. I would love to talk to you. I look forward to hopefully working with you. Have a great day.